Japan Journal, the internet's #1 English language weekly online cybercast from Japan. Japan Journal with Mal Adams. Well, Doctor, thank you very much for giving me your time, and let me just welcome my viewers to this edition of Japan Journal. It is a special edition of Japan Journal on the internet's #1 weekly English language online cybercast from Japan with your host, yours truly, Mal Adams, here coming to you from beautiful downtown Kakegawa City in the center of the Japanese archipelago in the Media Arts Lab here. Due to technical difficulties, I apologize for the frozen image of myself there in that black hat and those sunglasses, but the doctor is with us live and direct. My friend, thank you for joining us.
Thank you for having me, and I hope everybody's doing super fantastic in Japan, and I look to share information with the good people there.
Well, I've heard a lot of interest. You certainly have become a notable person on the Japanese social media here, and that's why I was compelled to invite you to address my viewers who are global, not only Japanese, but a lot of African-American friends from my hometown in Omaha, Nebraska. So shout out to Omaha. Okay. Doc, let's just get in and get her in right here. Congratulations, first of all. I noticed that you have, as a result of your new notoriety, have become appointed to what? Explain it to me, because I don't have the notes in front of
me. Well, I got appointed to the National COVID-19 Healthcare Task Force for the National Black Caucus state legislators throughout the nation, through Dr. G.A. Hardaway, who's the chairman, and they appointed me to that position last week. So it's just an honor to be able to be on the Congressional Black Caucus staff as their medical advisor, advising policies and issues for Blacks throughout the United States.
Crucial, and congratulations. Well-deserved, and I'm glad you're being discovered. This has happened to you in the last 6 months. I mean, you modestly proclaim yourself as a nobody, but I beg to differ, my friend. I'm pleased and proud to have you on this edition of Japan Journal. Tell me, in a word, how it's transpired for you in the past 6 months.
Well, I mean, it's really transpired. Well, I mean, if we go back from where I really originally started, I was in Peru, I live in Peru, and I run a program in tropical medicine, and I'm the staff surgeon for several hospitals, and I have about 65 doctors that work for my program, the Tropical Pathology Infectious Disease Association. But, disease is something we do all the time, and a lot of people don't understand that, guys at my level, infectious disease specialists and, professors of virology and all that stuff, we monitor the paper. Every morning, I get up at 3 in the morning, I'm reading newspapers and articles all over the world looking for disease outbreaks. I'm looking for the cholera outbreak in Africa, or Ebola, or, an influenza outbreak in China, or some type of disease, malaria outbreak in South America. And, I kind of noticed this back in December through our intelligence, is that, there was something coming. And, and then January, I knew a little bit more. And then, the end of January, I started calling all my loved ones and telling people to get the water, order these masks, et cetera, et cetera, et cetera. And then February 3rd, March 3rd, I was back in the United States, and flew directly from Peru to Vegas, and I started doing biosecurity protocols for the Tao Hospitality Group. But because I'm the physician, one of the owners, and they wanted me to put in these protocols so people didn't get infected, it doesn't get infections and stuff. And so from there, it just kind of snowballed. And about, the middle of March, my daughter, who's a pretty little famous person in New York, says, "Dad, let's do a interview." So because all my friends, they're calling me, asking me all these questions, and people are scared and anxiety. And so we just did a one-on-one dad to daughter talk. And after that, that thing went viral within a week, to over, 200,000 people.
I saw it and I immediately called you. And we have had several conversations offline, and this is our first online recording for public. But a couple of things you said, there in that last presentation. You mentioned that you noticed something was coming. Now, immediately I think of Dr. Fauci, if I'm pronouncing that correctly, President Trump's go-to guy for this thing. And he has drawn a lot of, I don't know if I can call it suspicion. The people were saying, how did he know? Because he's on record predicting that in 3 months from the time he was speaking, that we would be in some kind of a pandemic. Talk to me about that and make us understand how that happens, because you just said it.
Well, for what I understand from my background and, dealing with diseases in the field, and we're talking about in the jungles of Peru, in the biological laboratories in Germany and in the military, we have a feeling when we can look at news and we see disease outbreaks, i.e., there's increases of cases of infectious diseases in China, or there's a monkey die-off in Africa, or there's a pig die-off in Iowa. Usually it tells us that there's a virus about to jump into man.
Wow.
And so for me, I know what's going on in the real world. When it comes to Fauci and these guys, I'm going to have to just keep it real, is that, I don't know what they're thinking, but I know that what we're thinking in the field. And so if he came up with his opinion, that's on him. He's going to be judged by history of the people that have died because he didn't keep it straight and just be straightforward with science. That's what makes science so beautiful, is that there's no politics in it. Viruses do what they want to do. They don't recognize borders. They don't discriminate. And what's happened is that, him and his people, they're, to be honest with you, they're jaded. They didn't keep it real.
Okay, Doc. Let's stay right on this line, because where I'm going next is viruses don't discriminate. But in the United States right now, due to environmental disparity, class, economic strata, or whatever, African Americans are reported to be among the most, potentially most capable, most,
Well, the word you're looking for is the most, danger.
Susceptible.
Susceptible, danger, healthcare disparities.
Speak to that for me. Why is that?
It's not just only, blacks in America. It's Native Americans on Indian reservations. It's our Mexican Americans the same. But at the end of the day, we already know the reality. We had healthcare disparities before that. We've had it for 100 years in the United States. Even if you want to get technical and keep it real, we can talk about the Tuskegee syphilis experiment.
Oh my God, yes.
Talk about American apartheid, and we can talk about white people giving the Native Americans blankets with smallpox and measles and wiped them out. So that's a reality. When it comes to this issue of what's happening with minorities, it's the healthcare disparities. It's really healthcare discrimination. It's always been there. We've never gotten the right treatment. We've always been in the back of the bus. So now what's happening with this disease, this disease is important in one way because, if there was a black kid in Africa with Ebola, people don't care about that, especially white people. You got people in South America with malaria dying. People, they don't care about that. The only reason people care about this disease is because it can affect everybody. Right. It can kill everybody. So when it comes to blacks in this thing, it's once again, you can see what's happening, and they talk about healthcare disparities that blacks have, comorbidities, they have diabetes, high blood pressure, and all these other problems. And guess what? White people have them too. Mexicans have them too. Native American have them too. But the problem is that, and what the reality is that when a black person goes to the healthcare facility, they have the signs and symptoms of COVID-19. They tell them go home and quarantine. And so grandmother goes home for 4 days and she's quarantined and she gets a fever or she dies in that chair or at their house, or she goes back to the healthcare facility. Then they put her in the hospital and they put her on a ventilator, and we know that 85% of the people that are put on ventilators die, versus a white guy that goes in there and he gets the test and he knows he has a diagnosis and they do a different type of treatment plan. So that's healthcare disparity. And that's what I've been talking to for lots and lots of people in the United States, is about why our black people are having the problems we have. and that's because of healthcare disparity. Now, what this disease has done is pull the curtain pull the curtain back,
Sure,
and
you're
we
right.
actually see the light now.
Absolutely,
Really,
absolutely.
well.
Okay, beautiful. Thank you very much. That's going to clarify it in terms of stating what the conditions are, particularly in the United States. So Black people are disproportionately affected, and for the reasons that you outlined. And so it is not the virus that discriminates, it's the institutionalized health environment disparity in the implementation of services. Would I be correct in saying that?
Oh, absolutely.
All right.
I can give you the Dr. Rowling version. I can give you the Mickey Mouse version.
Give me
And
the
let's keep
Dr.
it real.
Rowland version, man. Come on.
Well, let's keep it real. We know that we have healthcare institutionalized racism. There's still not enough Black doctors. You look at LSU, and LSU puts out one Black doctor every year for 30 years. That's 30 Black doctors. They ain't done anything.
Wow.
There's several million Black people in Louisiana. So we already know that there are a lot less doctors that are Black, nurses. We have substandard, clinics, and so it's always we're in the back of the bus in this, and this just makes it just that much more, bigger problem. And now what's happened is that the Blacks and the Mexicans, and we're on the front line. These guys are on the front line. They're your frontline workers. They're the people at Walmart.
Sure. Healthcare workers, actually.
Healthcare workers, and they're sick and dying left and right.
That's crazy. Doc, you touched on something I wanted to go to, but let's go there now. What makes you so special? You got 30 doctors in 30 years. Talk to me, man. You're a military brat. I know that. To who do you attribute your motivation and your inspiration coming up as a young man? And tell me that story, man. Where you from? Where were you born? And where have you lived?
Well, I was born in this great state of Louisiana. Lived all over the world: Japan, Okinawa, 2 years; Germany,
right
military.
here in Japan. We're in Okinawa,
yeah,
man?
Okinawa for 2 years.
Should have hollered at me. We didn't know each other.
Lived in Peru for 12 years, and I was very blessed to have the military pay for all my education. And when I was 5 years old, my mother gave me a microscope, and because I wanted to be a heart surgeon, astronaut, or a fighter pilot.
Wow.
He put that microscope in my hand at 5 years old, and I saw my first organism, bacteria, at 5, and I just became addicted. And then I remember, and then you asked me how I got to where I was. They thought the white teachers are telling my mother that I was retarded or had mental challenges, the political correct word today. And my mother told them I was bored. And that's kind of funny because I have 2 doctorate degrees, a master's degrees, 2 BS, and a minor in military science. And I'm an officer and a professor of virology in Germany. And I run a program with 65 doctors. So I was pretty retarded to go where I was.
Yeah, right. You got 2 BSs, but that ain't no BS. If I may make that pun. Jesus, man, come on. This is incredible, man. This is incredible.
Yeah, but I was fortunate. I always took advantage of the opportunities that were given to me, Mal. That's just the way it is. I had to be the best. I could not be average. I couldn't be like the average, white boy, going around trying to figure it out in life, smoking marijuana.
Yeah.
I didn't have that opportunity. I got so sick and tired of these people telling me what I couldn't do. So I have 5 degrees. I've taken all the courses. You can't tell me anything about education. I'm a professor. You can't tell me anything about surgery. I wish you would step in my face, because it ain't going to happen.
Listen.
Because you don't have the training I have. I haven't seen you in the jungles of Peru. I haven't seen you in the villages. I haven't seen you carry an 80-pound medical backpack to go rescue a girl that got bit by a snake. You haven't seen patients with malaria, dengue. You're not in Germany with me teaching, or you're not on the same publication I am on, like the Journal of Nature Microbiology on Zika research. So where do people get their ability to talk if they can't back it up?
Okay, let me back you up now, because I didn't want to leave that point about your upbringing so quickly. You got that daddy DNA, don't you? Wasn't he a military guy as well?
Yeah, my dad was military. We're 4th generation. My son just got his commission just 1 week ago. He's a 2nd lieutenant.
Congratulations, man.
Yeah, military police. So we're 5th generation military. So when people start talking about United States, don't talk to me about United States. my people fought and bled for this country
Oh,
and through the
man.
military. So I'm a military guy, a military officer, and
Right.
military taught me discipline, dedication, and determination, and a no quit attitude. And that's why I am what I am today.
Well, now let's talk about your mom appropriately, because happy Mother's Day to all the mothers in
Yes,
your life.
yes.
Yeah, man.
Hmm.
And was it your mom that gave you the microscope initially?
Yeah, my mother gave
All
me the
right, then.
microscope. Yeah, I
Let's
mean,
shout out to mom.
yeah. Happy Mother's Day to
Happy
all the
Mother's Day.
mothers out there.
Absolutely.
And I was just blessed that my mother gave me a microscope. You know, one of them kids microscopes that you can buy at Toys R Us.
I had one, but I ain't got a degree.
Yeah. And I got one of them. And then, you know, if you go to my office in Peru, I have, beside my $5,000 microscope,
Yeah, right.
I have a $26 toy microscope that I have since I was 5 years old.
That's crazy. That is
Same
crazy.
one.
Yeah. Next time we do this, bring that. I want to see that one.
It's part of my heritage. I'm old school, you know.
Absolutely.
I'm real. I'm real, and I have a real life experience, a real life Black American experience, and nobody can take that away from me. And that's just the way it is. I mean, I'm not an African American. I'm a Black American with a Black American experience. Period.
Okay, man. Well said. Well stated. Let's go to science now, regardless of your color or your complexion. You're highly melanized and you're blessed. Let's go back to the science. And I'm not a scientist, but I'm a journalist, and I got a couple of questions. And I want you to. I have heard your definition of what COVID-19 is, but I also heard you say that there's about 33 at the time we last spoke, 33 variations on the form. Maybe what, up to 40 now?
Yeah, I mean, as of yesterday, we're up to 40 different COVID-19 or coronavirus strains that have circulated in the world.
All right.
And this thing is mutating on a regular basis. We have a mutation that they found in what we call the D614 gene of the RNA pattern genetic material of the coronavirus. And this thing has made the virus more infectious in attaching to cells and causing an infection. So we're up to 40 different mutations. This thing's mutating as we speak. You know, maybe in 2 weeks, it might be 60 different strains.
All right, great. Here's my question. Some are saying that it started in, the prevailing official statement from the time they initially stated it has been recouped and re-edited and stated in other ways. But some are saying that it started in the wet market in Wuhan, but experts are increasingly theorizing that it could very well have been experimented on through enhancement efforts, we'll talk about that later, by genetic engineering by humans at the Wuhan laboratory, and maybe even starting in Fort Frederick?
Fort Detrick, Maryland.
Fort Detrick, Maryland. I know you've been there. Talk to me about that question, Doc. And to the extent that it can start in a bat or some other kind of animal and then do the spillage, as you call it, to humans. Deal with that for me and give us some real scientific insight as to the possibility of that happening or the probability that this may have been a genetically enhanced, engineered virus in either one of those laboratories. Talk to me about that.
Well, it's almost impossible for this virus to be manipulated. Let me explain to people about COVID-19. This coronavirus is not a new virus. It's an emerging virus. This particular COVID-19 was first discovered in 1960. It's probably around maybe 100 years more.
This one came from SARS, did it not?
Oh, well, SARS is the same family. You know, we have SARS-CoV number 1. You know, same thing as a coronavirus, you know, but a different type of coronavirus. And, you know, in its genetic makeup, that's why we call it COVID-19. But this COVID-19 has been around for a while. We just call these emerging viruses. I think the society got this word novel. It's not novel. It's not new. It's been around for a long time. And as a scientist, and I don't deal with conspiracy. Right. I don't have time to do that because I've heard, that's
why I asked
people drinking Clorox and. You know,
oh my God! Please don't go there.
Yeah,
people set me off.
Yeah, people got a feeling. Well, we don't deal with feeling in our world because when we put your butt in a body bag, it's over with.
It's over.
You'll be a footnote in a week. But let me get back to what I'm saying is that So we've already looked at the genetic map of the virus, period.
Okay.
I mean, all the top scientists in the world, we've looked at this, and this this virus came from a bat and jumped into a human being. And this is a strain that's circulating in the world because we know because of our science. And I teach molecular medicine. I teach molecular diagnosis of infectious diseases in my program. And we can look at genetic pattern and see if there's been any genetic engineering, any modification. This virus jumped from a bat, and the bat DNA, RNA matches with what's in man and nothing else. So this is not come from a laboratory.
Okay.
It came from a bat. It jumped into a bat. We call it spillover, accidental host. And people need to understand that 99% of the times when we're getting infected with viruses, these viruses coming from donkeys, pigs, chickens, cows, bats, monkeys, whatever. People eat this stuff. They go deeper in the jungle and they get infected by the virus. And the virus sees brand new individual, no immunity to it, and that's how the infection starts.
Okay, back to the term I used. I may not have used it correctly, but generally it's talking about enhancement efforts having been detected in the analysis through genetic engineering. Is that a possibility? And specifically, when it comes to bioweaponry?
No, I'm going to say that no, because I am certified in the medical management of chemical and biological warfare, and I have a background in molecular genetics. And
I got the man on the show tonight, baby. I got the guy. Appreciate you, man.
And I want people just to think about this. We have a term called blowback.
Yeah.
And you don't create a virus that you release into the general population, no matter what, and it gets out and it starts killing not the people you want to kill, but it also kills you. We call that blowback.
But
you have an antidote.
But Doc, in Maryland, the military, give me the name again. I'm sorry, Fort Detrick.
Yeah, Fort Detrick. Yeah,
okay, as early as 6 months ago, they were reprimanded and cited for having some loose discipline there. People walking into contaminable rooms without certain protection and stuff. I did that research myself. So it's possible that somebody with an agenda can screw up, man. Human nature. Come on.
No, I mean, anything's impossible in life. But what I tell people, because I have too much responsibilities. I've seen too much horror in my life to get into a debate or, if people have a viewpoint, what I tell people is that you know what you know.
That's right.
That's all I'm going to say.
And what I say is you don't know what you don't know. So we're gonna leave it there. But thank you very much. Thank you for that description. I'm with you, brother. I'll take it from you. I'm going with you.
I'm gonna look at you. I'm gonna look at you and go, you know what you know.
Yeah,
you know what I'm thinking in the back of my head.
Yeah, right.
Yeah, go ahead and drink that Clorox.
Yeah, oh my God.
You know what you know.
Yeah, right. Well, and from my point of perspective, don't necessarily believe what you hear. You consider the source who told you to drink that Clorox. We'll leave that right there.
What do you think, Mal?
Yeah, man, come on, please. Come on.
You've been on this planet for a while.
Yeah, buddy, I've seen behind the curtain a couple of times too. I'm not drinking no Clorox, man. I don't care who the president is.
Man, and the sad thing about it is people did it. People
drunk. Man, come on, man, really wiping it on their lips and stuff, man. So, okay. So my interest is in putting a variety of ideas out there, let people vet it intellectually, do their research and stuff, because that's what this game is about. It's about information, and that's why I'm appreciating you so much, man, because you got it off the tip of your tongue. You can bring it. It's valid. It's certified. And if you say it, I'm gonna invest in that, man. Okay, so all right. Tell us what happens when you get the coronavirus, and I suspect the symptoms change as the degrees of this virus change. We're up to 40 something right now. How do the symptoms manifest themselves? It's not just lungs. It's bone aches. It's body aches. It's diarrhea.
Right. Well, well, let me give you I'm gonna give everybody the people in Japan and your audience worldwide.
Okay.
You know, the basic symptoms of COVID-19. One, you can have loss of taste. You can have loss of smell. You can have a headache. You can have pain in your eyes, muscle aches. You can have pulmonary involvement. You can have shortness of breath. This virus affects your liver. You can have kidney problems. You can have strokes in your leg, clots. You can have COVID toes, where you have little mini infarcts, embolism in your toes.
Hey, I saw that recently.
One of the most important things is people having diarrhea. And your audience needs to understand there's really two modes of transmission of COVID-19. 75% of the transmission infection rate comes from aerosol, people speaking the air. And the other 25%, and this is fact, this came out 2 days ago, and we were already talking about this 2 months ago, 25% of all cases for COVID-19 comes from feces, from people using the bathroom. People poop in the bathroom, they flush the toilet, it goes to, the spray gets sprayed all over the toilet.
Sure.
And, people don't put down the lid. People don't wash their hands. They go out and they touch the door handle. They shake other people's hands. So the major two transmission of COVID-19 now is aerosol through your lungs. And then the secondary is feces.
Wow.
And then what I also want to tell you, and this came out the last couple of days, that there's another syndrome, because, this just shows you what people thought they knew, but they really didn't know, because early in the disease, they were telling you, oh, it just affects older people. Don't worry about the college people or children. Now we have a new thing called Kawasaki syndrome, where kids are dying here in the United States, France, Japan, even in China. And these kids are 9 years old, 7 years old, 12 years old, and having heart attacks. And this Kawasaki disease is a secondary complication of somebody being exposed to COVID-19, but they're pediatric patients.
Wow.
So this is a very serious problem. I was talking today earlier on television, was that we need to understand that we already have health disparities among Black adults. So the Black people out there need to make sure they protect their children, because there's another syndrome of COVID-19 called Kawasaki syndrome, which is a multi-systemic inflammatory disease of the coronary arteries and arteries, and our kids can be vulnerable to this disease also.
Great. Having said that, Doc, it brings to mind a question and another issue. And I'm a social media guy, so forgive me if this is not a scientific question, but to the extent that African Americans have traditionally been abused, oppressed, repressed, used as guinea pigs you mentioned the Tuskegee thing. And it has created in the minds of some people in the community that I'm not taking that vaccine that Bill Gates is financing with Dr. Fauci so that they could get the money and get a patent on this thing. I just went there. Talk to me about the realities of vaccine and vaccination.
Well, I don't care if it's Fauci. I don't care if it's Bill Gates. I don't care if it's the French white scientists in France or the UK. You want to make a vaccine, you take the vaccine, and I'm sorry to say this, but go ahead and put that and shoot the white kids in Beverly Hills. Go ahead and shoot them and practice on them in France and Europe before you take it to Africa as Africans are guinea pigs. And that's the continual case. Everybody wants to run to Africa and inject people. And we get all the complications and why their kids are. So my philosophy is that, if you want to play the game and we're all in this together, then you need to start with your own people. And, you shoot your kids. Shoot your kids and your family with the vaccination, and leave them Black kids alone in Africa until you got it perfected.
Boy, listen, man. Come on, Doc. Ah, man. Thank you. Wow.
It's true.
Man, I know it's true. Yeah, but if you say it, it's true. And I've said it, and other people have said it, but you get pushback because,
let's keep it real. Have Bill Gates or, inject his kids with a vaccine. Go ahead and do it. Have all these politicians, everybody want to run to Africa, and they don't give a damn about Africa or the African people just because of their internal racism. and that's just the facts. Well, you know what?
Well,
If you're not gonna help-
driven by power, money, and greed with big pharma. All these guys got
Well, you know what?
contracts.
Well, take big pharmacy and go to Reddings,
Yeah, right.
California, and or Santa Barbara with a bunch of white kids, and inject all of them, and then we'll see what happens, and they can go all the peer review and articles and journals, and then we'll figure out if we should take it.
Thank you. You're giving me a new entrepreneurial opportunity. I'm gonna promote that mission. We're going to Beverly Hills with the vaccine, man.
Yeah. If they can get the test first for confirmational tests,
right,
and other people can't get it, why can't they be the first in line to get the shot?
Thank you. Wow, that's too much truth, Doc. Come on now, man. Stop. This is a social show I'm doing here, man. That's too much truth.
Hey, I'm just talking.
I know.
I thought I was talking to some folks in Japan.
Yeah, well, no, you are, because I'm translating this show. Trust me, I'm translating this show because, listen. Do you know why I've been living in Japan for over 40 years?
You tell me.
Don't take me there, okay? I raised 4 children over here, beautiful, healthy, smart, intelligent, and good looking. And so, I invite all my brothers and sisters to come over here, if for nothing else than, since you're saying that feces is the most direct contaminant, we got those toilet stools that will wash your behind before you get up, man. So, I'm looking for the stats on the degree to which that, you know what, trust me, sanitary. I don't wear my shoes in my house that I've been walking in feces all day on the street. Come on now.
And I've talked to
It's cultural, man. It's cultural.
It's culture. I said Japanese people don't wear their shoes in the house. I live there.
I know you did.
It's a smart thing.
And talk about
coronavirus is on your shoes.
Thank you. You walk on the street all day, come in and put your feet up on the couch, put your shoes on. What is that, man? I've been living in Japan longer than I've been living in the United States. I've been reculturalized, man, and I can't deal with. Look, for whatever about wearing a mask, Japanese wear masks year round if they got a runny nose, so as not to contaminate you. Isn't that a lovely thing?
It's a different culture, and they figured it out. The mask is to protect themselves and protect other people, and it's a smart play. A mask is a barrier to the contact of the internal external environment. So I don't see any problem with that.
I'm just saying from a cultural standpoint. I'm being a little bit facetious, but hell, I've been wearing a mask off and on for 40 years in Japan before the COVID-19.
Well, you got people in the States, man, and I'm just being this doc. People are fighting. They don't want to wear a mask. Well, you know what? When you get infected, you're going to have a different attitude.
That's right. And if you don't come near me without a mask on. Thank you very much.
Yeah, because I want to dictate my own pace.
Thank you very much. Well, Doc, listen, I don't want to take up too much of your time. I know, all the mainstream media people are calling you. I'm just an independent journalist brother here doing cross-country communications in Japan for giving a voice to the voiceless. You know how we do, and also educating and informing my Japanese loved ones that I'm surrounded by over here. So let me, before we end this particular show, and I ask you to come back and please commit to contributing from time to time as things develop. Will you do that for me?
That's what I was built for. I was built to teach people. That's what I'm a professor of, in teaching people and giving back to not just to my medical students, but to society, to give people the best information, and that's the reality. And, like I said before, I'm a nobody, but, but I'm a nobody. So, I'll keep it that, but
okay.
You know what, just keep it real. There's not too many people that have my qualification on this planet.
All right. Look, trust me. I've done my research. Couldn't find anybody. I came to you. Happy to have discovered you. And not to digress, but I saw you on the show with that lovely daughter of yours, man. You done well, son.
Hey, I still change your diaper, but at the end of the day, but when you think about it, how pure is it for your daughter, your baby daughter, who's a journalist and media type, to come to you and say, "Hey, I want to talk to you"? I mean, that's pure. 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 with a huge following and says, hey, my dad's an infectious disease. I just want to just talk to my dad
Hey
one-on-one with my
man, hey,
friends. And how
I
pure can you get to get God? How pure or
listen,
better can you get than that?
I saw her as a 50-year professional journalist at the international level with the major networks and now independently for 30 some years. She's got skills, she's got discipline, she's got insight, and she interviewed you like she didn't know you, except for the occasional like, "Don't embarrass me, Daddy," and all that stuff. I love this. Don't put my business out. Man, that was
Keeping
so
it
beautiful.
real.
Where are you gonna see that stuff, man? This is so beautiful.
Tell
You
me,
guys are so blessed,
Mal,
man. Huh?
Mal, you're the professional, man. You've been in this business for 40 plus years.
Hey,
You're the
man, come
professional.
on.
You've seen it all. So you
Well,
tell me.
believe me, I'm not, well, listen, I can't compare to you, but I have been behind that curtain. I've stood next to George Bush Sr. with a drink in my hand, you know what I'm saying, more than once.
Right.
Presidents, you know. So, yeah, the business is interesting, and it makes me ask questions that may not be popular.
And I think people love just the fact what, because I mean, we went to almost 200,000 followers in a week,
oh
and
my
it's
God.
blown up. And it's just, I think what we see, most of the comments probably just says, my God, it was just beautiful. Just a dad and a daughter just talking.
When I
And I'm
read,
giving her the information because
Mhm.
of her anxiety of what's going to happen to her and her friends.
Listen, man, I'm an entrepreneur, okay? Self-employed for damn near 40 years. When I posted you, I got hits talking about, Mal, thanks for sharing this. I'm saying, okay, I'll see if I can get him back on. Because I'm monetized on YouTube, baby. So for all my viewers out there, like it, click it, subscribe or whatever, because we're coming back with more from the good doctor. And speaking of entrepreneur,
Sorry about that. I
speaking
just
of
want to say,
entrepreneur, those are, go ahead.
Mal, I want to tell you, thank you very much for giving me the opportunity to talk to you people from the bottom of my heart and
Oh
stuff.
man,
And,
we
because,
appreciate it.
I've had a long road in my life, and
Oh, you
to
have.
be able to talk to you people. And if you want me back in 3 weeks for updates,
Sure,
make it happen. I'll be your
sure.
in-house resident medical advisor until this pandemic's over.
Yes, sir. Appreciate that very much. Vital service that you're providing here, my friend. And by that time, I will have the technology of this meeting software, whatnot. I use a very complicated professional thing called OBS. I'm shouting out to all people because it's the coming thing. People are going to be able to do their own interviews globally, as I'm doing here now. OBS
Right.
is an open broadcast system, but it's very professional. It's not for a beginner, but it doesn't incorporate Zoom or other chatting meeting applications so well. So we'll get it right by the time next time you come. But before you go, talk about your enterprise for me, will you? Your books, your seminars, your training excursions to your facility in Peru, the research and experimentation that you're doing. How best for people to deal with the unprecedented nature of the pandemic spiritually and psychologically and morally. In your last comments, put all that together. First of all, you got any books for sale, or are you doing seminars? Are you open for being invited?
Only I have this for sale is, and it's really not for sale, is if people want to have the opportunity to come and train with me in Peru or in Germany, they can sign up and do our program. We probably do about 200 students a year in Germany and in Peru, where people go in the Amazon jungle and they study diseases, they study molecular medicine, they study all types of diseases from malaria, and they learn the surgeries, and they see people with diseases. They learn the virology in Germany. So we have that opportunity, and I'm just fortunate to be in that. I'm fortunate to be the director, and we want to give people the opportunity. We want to give kids the opportunity. I've gotten messages from people, saying their 12-year-old daughter wants to grow up and be like me. They want to be a virologist like Dr. Rowling. So we must be doing something right. So I'll keep doing what I'm doing.
I'm gonna put you on the spot here because I'm a businessman. Would you invite me down to do a week's coverage of what you do down there, so I can do a mini documentary on it and make it available to all my viewers?
Oh, absolutely. And in fact, what we need to do is you need to probably contact 20 or 30 students in Japan that want to have the opportunity to come and study tropical disease with me for 7 or 9 days in the jungles of Peru at my hospital.
Great idea. I'm on
You should make that happen.
I will do. I just converted my English. I own an Adams International Academy. One of my enterprises is my English school here that I've been doing for 37 years. And I just converted over to using Zoom and this kind of video conferencing to the degree that all of my classes in one day are conducted online now. And with live video like we're doing here, because the facilities, the public gathering facilities, arenas and cultural centers are all being closed down because of the virus. So I'm not trying to lose that tuition money. So I took them online and they love it. So I will recruit them.
Tell your students, they can go to the Tropical Pathology Infectious Disease Association, our website, which is www.tpida.org. You can pull applications for them and you could screen them now and say, say how many kids want to go to Peru to study infectious diseases and see this stuff and get certified in it, hanging out with Dr. Rowland and his people.
No, I'll go straight to the universities here in Japan. We'll get some people who are inclined to study that kind of stuff, who are majoring in that stuff. And
we're going to have to because
we'll put that together. But then I want to do the video of them interacting with you and having that experience. And I think.
Oh, absolutely. So the door is open for you, and
appreciate it.
Like I say, I'm just a normal individual. I'm just mortal, like everybody else, and but my responsibility and my passion and my inspiration is to educate people and take care of real patients in the field and help save people's lives. And I think we're doing that with this program.
All right, my friend.
And I look forward to coming back next time.
I appreciate you very much. Stay right
Take
there
care.
as I close the show.
How do you say, I can't remember, how do you say good night in Japan? Or bye?
Good night is oyasumi nasai. Oyasumi nasai.
Well, I'm going to tell you.
No. We got you're a professor, but I'm a language instructor. Listen and repeat after me. Oyasumi nasai. Hi.
Yosasa be my knife.
You stick to virology, man. You murdered. You just murdered.
I'm gonna tell you how we say goodnight in my Navy here.
Okay.
Man, yo, bro.
Yo, my brother, I'm out. Well, listen, before we do that, let me just stay right there. Don't go anywhere. I want to thank my viewers from all over the world who are watching this. We're going to be doing it again and again, and as long as this pandemic lasts. And to my Japanese students, minasan, goran no minasan, hontou ni arigatou gozaimashita. Mata gakko de moto kuwashiku setsumei shimasu kara. Dr. Lane Rolling in the house. See ya, wouldn't want to be ya unless you were right up in here with us in the Media Arts Lab in beautiful downtown Kakiao City on Japan Journal, the internet's #1 weekly English language online cybercast from Japan, with Brother Mal in the chair, along with Dr. Rowling. Thank you, man. Appreciate you.
Take care. Be good. Right. Be safe. Bye-bye.
Y'all roll the credits and play the music. We out of here. Thank you, man.
Japan Journal, the internet's #1 English language weekly online cybercast from Japan. Japan Journal with Mal Adams.